Dr. Henry, can you give us some details on what clusters will be targeted with AstraZeneca? Are we talking regional or types of clusters, and how many AstraZeneca vaccines are we expecting to receive with this expiration date of the end of March, beginning of April?
Well, the second one, I don't know. These are all things that, as we, way back in December when we said it was changing every day, well, it's changing every day. We don't know yet. We understand that there's some proportion of the 500,000 doses that arrived that have an expiration of April 2nd and some that are much later in the month. So we don't have details on that yet. We don't have details of how much of which we'll be getting. There are a number of ongoing clusters right now. We can look at the data and you can see that the rise in 7-day rolling average of cases, the outbreaks, the clusters we're seeing in communities are in the Lower Mainland particularly, and that's where some of the more recalcitrant outbreaks have been. Some of them are in food processing, some agricultural working. We're also looking, we've had some ongoing outbreaks in the north. So my public health team and the BC Immunization Committee are looking at where we can best stop these outbreaks that are ongoing in people who don't necessarily have the ability to effectively use personal protective equipment and barriers in their workplace. And food processing is the highest risk of those industries, and we've had ongoing outbreaks that affect large numbers of workers, and not only workers but the community. So people who are getting sick in a food processing plant in the Fraser Valley, many of them are lower paid workers who live in communal large settings, either communal settings or in multi-generational households, and this spillover into our communities that then is into other areas through transmission to family members. So those are the types of outbreaks that we can make a big difference on right away with added vaccine that we hope to get in next week. But the prioritization of that is with my public health leadership team right now.
I know you've touched on this a bit about the approval of vaccines like AstraZeneca and possibly the Johnson & Johnson, but how far does that go to possibly moving your timeline up to immunize people that are younger in general? Like you mentioned that there are a lot of people in their 20s that are struggling right now. Do you think that we will be able to move the timeline up sooner so that we'll see a lot of younger people being able to get at least their first dose over the summer?
Oh, I hope before the summer. Yes, absolutely. And we are looking at revising the timelines. We didn't have time to do that for the graphics for Monday, but with the new information. And as we have more vaccines, this is why we've been trying to focus on the what we knew was coming in, focusing on where we could make the most difference the soonest, and that's the age-based foundational program. But with these additional vaccines and our ability to be more flexible in how we use them, we need to address those people who have not been able to work from others, away from others at home, and they are also, we know from the data on cases, people who are more likely to be transmitting. So in terms of being able to reduce the effects of the virus and transmission in the community, targeting as much as we can to essential workers and to frontline first responders, that's going to help us reduce transmission in the community. So it does that dual effect, and our goal absolutely is to make sure that we, I like to, I don't know, maybe I'm too optimistic, but we're going to be in our post-pandemic world by the summer if things continue to go the way that we want them to. We know there's going to be snags, so I hesitate to say that, but I think it was Eisenhower said, no plan survives first contact with the enemy, but we are going to do our best, and we are going to make sure that young people have that experience. And I think by the summer we're going to be able to be doing a lot more of those connections that we need, that's going to help us get through the trauma that we've all experienced together.